Clerk, will you please call the roll?
Not a problem. Mr. Bailey?
Present.
Dr. Bustles? Mr. Brennan?
Present. Please, for the record, Mayor Rickman is joining us today. Ms. Wilson, I want to thank you and staff, Ms. Heppard, for pulling this together so quickly. It's a timely start. Here it is the first of the year, and we've got big plans for a big census here for our homeless population in January. So we look forward to learning more about our homeless services, our successes in the past, and how to carry it forward, but also start the conversation of a broader participation in partnering with our service providers. We committed a lot of funding for homeless services through the Rapid Shelter and the pallet homes. And we look forward to hearing about those successes, what more we can do, but also in general, where else we can help in the community, be a partner with our service providers. Mr. Bailey, do you have any comments before we get started, before I throw it to Ms. Wilson and Ms. Heppard?
No comments other than I appreciate y'all working quickly to get this as well, and looking forward to hearing the reports.
Yes, sir. Thanks to both of you for your leadership. And I think from our perspective to the staff, always hears me say that we stepped into some uncharted territory a little bit on faith 2 years ago, and I'll let Kamisha talk about some overall successes and still some room for opportunity. But I think with the ad hoc committee formation, Mr. Chair, it makes a lot of sense because there's some immediate opportunities I think that you all want to address with the help of the providers in our area, as you indicated. And then, of course, there's the broader long-range plans too. But we've tried to approach some of these conversations to prepare for this meeting today, particularly about some immediate things to include that point-in-time count. So I'll let Kamisha Heppard, our Director of Homeless Services, start with an update.
Thank you. Thank you, Councilman Brennan, for the opportunity, City Manager, and I'll just jump right on in. So we know that the City of Columbia established homeless services in 2022, and since November 2022, we have made some great accomplishments. We have permanently housed 79 individuals, 79 chronically unsheltered individuals. We have collaborated with some non-traditional partners. And what I mean by when I say that is those partners that are willing to think outside of the box, do some innovative strategies to execute services, because we know that the population that we serve is resistant to services. So historically, partners would not provide services to a dual diagnosis individual, meaning they have schizophrenia and they're using substance. They want one or the other to be resolved before they would take action. But evidence-based practices show that it's best to address that simultaneously. So
Let me ask you a question. What does it mean when somebody resists services?
just in layman terms means that they don't want services
At all? When someone from outreach comes out to help them, get them services, they decline it?
They decline.
Okay. Gotcha, thanks.
Yes, sir. Oh, I thought he seen his hand raised. So you'll see, I said since June 2023, 27 residents have received aftercare services with a total of 115 engagements. And I highlighted June 2023 because when we first started, there was some challenges we had, learning curves we were on. But I feel like in June 2023, we mastered executing aftercare services, which aligns with the wraparound services that the mayor talks about often. And 115 engagements means that every time we made a phone call, every time we took a person to the food bank, or we took them to the grocery store, we took them to update their certification with DSS, and this is all with individuals who have been permanently housed. What you're looking at right now is the data for Rapid Shelter Columbia, and this data is from November the 1st, 22 to December 31st, 2024. I'm not gonna read everything to you verbatim, but what it shows again is that we housed 79 individuals. We currently have 46 individuals at the Rapid Shelter. We have received 827 referrals from the community, and I think that highlights the need. It shows how many veterans we have admitted, and that's 29. And then we have a breakdown of your last permanent address. And you'll see Richland County is leading, other counties is at 11%, and outside of South Carolina is at 5%.
Mr. Chair,
Yes.
Ms. Hepburn, can you give some more context to the county of last permanent address? Are those the percentages for the number of total participants or referrals? How should I look at that, essentially 50% Richland County? Should I look at the discharge number of 50%, or is that total of everybody who's reached out to y'all?
So I'm gonna answer, I think what is your first question is the last permanent address. So in the intake, so this is everybody we do an intake on. In the intake, we ask that question, what's your last address you had, like of your own, not sleeping on the street, and that is that.
Are there any other counties that stick out to you when you have other counties just off the top of the head?
I actually have a breakdown for council, but it's for council.
Okay.
And I can give you that at a later date.
And outside of SC as well?
Yes, sir, I have it.
Thank you.
You're welcome. Any other questions about the Rapid Shelter
Yeah,
client?
one real quick.
Yes.
So the grant is an overwhelming number up there of the total referrals. Our admissions are at 340, our referrals at 895. That's a pretty big delta. So are those folks going to look for services elsewhere? So that's kind of if we could wave a magic wand, we could be servicing 895 individuals from
Correct.
from just referrals.
We could be servicing 895 individuals, or that though the individual was not chronically unsheltered.
And so, and that kind of a comment I was gonna make, because right now, today, we have 46 residents at Rapid Shelter.
Yes.
And would you say it hovers around full capacity, which would be 50, or somewhere in that range on average? And I think that goes to, again, we're turning over, but we're trying to meet people where they are, so we don't turn people over until you feel like they're really ready and can be successful with permanent housing. And so, that begs the question, if we waved a magic wand and we had 50 more pallet units somewhere with that that requires staffing, a lot of other things, but you feel like you stay full, basically, there's the need.
Yes, ma'am. I feel like we stay full, and then I want to add to the referrals. So just because it goes back to resistance, just because there's a referral place doesn't mean that the individual wants to come. So Ms. Franklin is over the referrals, and she does a great job at it. So she'll do the assessment, she'll reach out to the client and see if they're interested and go from there. And if they're interested, we have an availability, they come, we pick them up, or outreach will pick them up. And I lost my train of thought.
And from Columbia Police Department standpoint too, we still have that aspect where if there's an immediate need from their standpoint,
Yes.
they can be brought to Rapid Shelter.
Yes, ma'am. Any other questions about the Rapid Shelter client data? Oh, got nervous there. All right. So we talked about data a little bit, and then we have some innovative programs that we have initiated in 2023, and that's the 2024, and that's the Adopt a Pallet initiative. So we started that where individuals in the community could sponsor a pallet and provide resources to a resident for a year. And it says 2024, but we started that late in the year, and I think we did an awesome job. So we raised over $9,000, almost $10,000 with individuals who sponsored the pallet. And those individuals who contributed to that was the Delta Sigma Theta sorority. They brought 2 pallets, G.H. Smith Construction, Smoke Construction, Lake Murray Utility Company, the Delta House, Booker T. Washington High School, W Realty. And we look to increase this even more in 2025, because what this does is it helps us provide direct client services to the residents financially. So we're able to get their documents, we're able to pay application fees for them, we're able to pay back rent, back utilities to help them get permanently
So it
housed.
doesn't necessarily go to buying another pallet, it goes to all the services in the
Correct.
process, okay.
Yes, sir. Any questions about that?
How can the public learn more about the Adopt a Pallet initiative?
They can reach out to Jonathan Cooper.
That's
Jonathan,
something we can provide on the
yeah,
website.
yeah. And also, we have that, he should be.
Oh, he's right behind you. You jumped right in, and I didn't want to take you off your train of thought. So at the end, we have to recognize this amazing staff that
Yeah.
Kamisha has pulled together in short order.
Yeah.
Mr. Chair?
Yes.
Are those donations tax deductible? Just for the public's consumption? No?
No, because we're a government entity.
But they can't. So what Kamisha's also been doing in her spare time and working with our legal department is establishing a separate arm of Rapid Shelter as a foundation. And so because of that very question, Councilman, we're trying to put in place the mechanism to make that more seamless for individuals, because we really need a whole storage facility. I mean, this community has truly embraced Rapid Shelter
They have.
Columbia. I mean, without them really even having to market it, now that they are, and creating these initiatives to make it be that people could come and say, I want to adopt a pallet, or I want to do this. We need to have the infrastructure around us to make that easy.
Yeah, and the Central Midlands Council Government Foundation
Yeah.
can be the financial, the fiscal agent
Yeah.
to make the lift easier instead of forming the whole board and everything. If you do want to go the foundation route, they've worked with the fire department on that.
So we're working on it. And,
Perfect.
Yeah.
And that's a
great.
good point that Ms. Wilson made, that all of this great work, the responses happened and it wasn't publicized. Like, these things was done behind the scene. Jonathan would put out an axe and they would just come through. I'm really bad with names and I apologize for that, but when Jonathan comes up, then he can tell you there's a church that really supports us in coming down to the shelter feeding, in literally coming to move our residents into the apartment, furnishing the apartments. We've even had a resident whose rent was paid for a year by the church. So the support is really great and overwhelming, and we appreciate it.
The mentorship program, I think, was your next.
Yeah. So I'm gonna go back. And then, so what we are going to be doing in 2025 is unveiling our mentorship program. And what that looks like is just community members can participate in this. They would provide support to the resident once they transition into their own home. What we know is that when the chronically unsheltered is placed in permanent housing, it's a struggle for them because they have created this community. And so now when you remove them from that, which we look at as success, and put them in their own place, they're struggling with anxiety and being lonely and separated from their family. So the mentor would help them just adapt to everyday living, talking about what the resident is interested in, what the resident is trying to work on, maybe take them to church with you on Sunday. It just depends on what the mentee's skill is. We could have a retired teacher that wants to be a mentor, and then helping with individuals who can't read and helping them read. Any questions about the mentorship program? So now we will move into the PIC count, the point in time count, that's led by HUD. So the PIC count is a count of the sheltered and unsheltered, and this happens every year in January. And it's decided that it happens in January due to the weather, they try to pick the coldest time, and then the time is at the end of the month, because by then, those individuals have depleted their resources. So now they're in need and they are available or, readily accessible. Any questions so far?
Why I picked the coldest day?
Because, so for some individuals receive SSI, they'll be in a hotel at the first of the month. The coldest day, they'll be, looking for shelter. And so then they're out there. When it's a warm day, they're not looking for assistance, they're not looking for resources.
My only question would be is, do you think that the coldest day may not be the accurate depiction of the number of a lot of people who are unsheltered or inside during that time? Just wondering why they picked the coldest time versus possibly a warmer day in the summer times when people are outside more often.
Day is HUD.
I know. For the record, day is HUD. Why does HUD decide?
Buffalo winter's a lot different than Columbia.
But to me, it does make sense because in the summertime, they are resilient. So they find a way, they figure it out. It just makes sense to me. I mean,
Thank you.
you're welcome. Okay, how has the pit count been conducted historically? And I asked that question because of the conversations that we have been having, trying to get an accurate count. So I wanted to know, how has it been done? And see how we can maybe give suggestions that it can be done differently. Because the mock is over the pit count. And so the location identification, mock and outreach teams, they sit down and they meet and they talk about the hot spots. And so that's how they identify the locations. They put teams together. In order for you to participate in the pit count or be a lead in the pit count, you have to have done it before. And everybody has to go through an orientation. The data collection, teams conduct surveys, gathering information about individuals' needs and providing resources, such as water and toiletries. There is, an application that on another slide, we have provided the link so that you guys can see the questions. Verification and data entry, mock verifies the information through HMIS. And the timing. So we talked about the count is intentionally conducted at the end of the month. Coordination, volunteer county level coordinators direct mock on securing volunteers. So, mock covers 13 counties, and in those counties, they have subsets of, for lack of better words, and they help coordinate the services in their area. So you'll see highlighted that it says CPD is requested to refrain from breaking up encampments before January 15th. And I guess they are asking that, so that they can try to get a more accurate count. Because if they break up the camps, then the people disperse. And so that was a request that they, placed as we were preparing this information. So this is a visual of MOP in the 13 counties, and you'll see them highlighted in the dark purple, and it just gives you a little history there. But I like to show this visual to show how the MOC is geographically large, and it can be challenging in trying to provide financial assistance with the stretch being so wide.
Can you, real quick, Misha,
Yes, sir.
can you just give us a summary of homeless service providers outside of Richland County in the MOC? I mean, I think Rock Hill has a facility, or they're like, let's take Barnwell, Allendale, Bamberg, Aiken. Are there service providers for homeless services in those counties?
So I know that Rock Hill has, and it got away from me, but they don't have they have a day shelter, that's what it is, where they feed, but it's not, overnight. And you said Aiken, so Aiken has providers.
What does that mean, providers?
They have providers that, so similar to Mercy Mental Health. I'm not sure, Mercy is not in Aiken. I don't want that to be said incorrectly, but they have services similar to that provide services to those struggling with substance and mental health.
But in terms of low barrier shelters, I believe that Richland County is the only one that's providing for all of this,
Correct.
right? So they may have some of those ancillary services of like mental health, substance use, but it's not a, one place where you can get all of those things the same way some of the services that we provide here in Columbia, correct?
Correct. Any other questions about?
I know you mentioned having data regarding people contacting us from different counties. I'm wondering if, although they're the Midlands market, would somebody like in Aiken probably contact Augusta service provider rather than reaching out to the city in Richland County? I guess the data you have may help us understand that a little more.
I don't have Augusta data, but I can work on getting that, but I did not go outside of South Carolina.
More than likely, they'd go to who else has that state level or federal funding. I think it gets a little bit hairy in terms of data sharing with the HMIS system and things that they're required to do as a part of the mock. So that could happen, but I think it'd be safe to maybe assume that they're more likely to go within the state because everything is structured that way.
Any other questions regarding the counties?
Yeah, that's very helpful to know the geography of that.
So council's role and key considerations. This conversation started when Councilman Brennan was interested in participating in the pig count, which made me really excited. So we gathering this information, and so what we thought would be helpful from the council is that in your divisions where you all serve, if you guys identified areas where you see the unsheltered that we may not be aware of, and providing us with that information, we would give it to United Way to add to their locations. And additionally, maybe you guys wanted to come in the field or ask your colleagues if they would like to participate in the pig count. That would provide more manpower to the United Way to conduct a consistent, fair pig count.
Ms. Wilson, our staff's very good at volunteering. Would we be able to do a call for volunteers from our staff?
Absolutely.
Public Works, Forestry, all our wonderful divisions to help out?
Yeah, I don't think they can say no to Kamisha. She's probably already started that process. They did help build the palace, so we will issue that call.
So how does the pig count increase funding? And so to be transparent, when I first started on this journey, I always thought that the higher the count, the more funds would be allocated. However, I have recently learned that that's not true. So the application has multiple components, and the pig count is just one of the components. And so how I understand it is that increasing the number of unsheltered individuals can possibly decrease the allocation to MOC. No one is really clear on what the HUD formula looks like or is, so we can't, match it up. But that was the information that I was provided. And so that's why I got all gung-ho and like, yes, everybody, let's hit the streets and let's do the counting. But now,
I'm starting to realize more and more locally, we have to bootstrap and do it ourselves in all aspects. And homelessness services isn't alone in that. So getting that accurate big number is very important
Yes.
locally to us.
and one of my other thoughts was that maybe we could do a count in the city of Columbia. But as we were looking, I didn't see anything that would be applicable to that, and then started planning in August. So if we were still interested in going that route, we would have to be to the planning table August 2025 with United Way to talk about if that's an option.
I'm sorry, say that
For the
again.
next.
For the next point in
go.
For the
time.
next point in time.
So when they are doing the point in time, I mean, I'm assuming that you have volunteers go out to different areas. We could still perhaps get an estimate if we know, like, okay, if this area is in the city limits. Right? Like, it may be a rough estimate, but we could get a general idea maybe. But I hear you that we should get involved earlier in August next year.
So that we could, because they already have created the questions, the application, but if we could be to the table this year when they start planning, we could request that we want to add questions that is specific
Oh,
to
gotcha,
the city
gotcha.
of Columbia.
Got it, okay.
But that's not gonna stop us from getting an accurate count
Nope, it's not,
in 20 days.
it's not gonna stop us from getting an accurate count, but it's gonna stop us from my initial goal.
Gotcha.
And what's your initial goal?
My initial goal was to be able to add some questions that identifies those city-specific things. But, you know,
Because she's still working through the United Way. I mean, the point in time count, the official count is HUD directed, and it's directed through the current identified mock. So we have to, which the administrator, I guess, for lack of better words, of how that count occurs now is the United Way of the Midlands. Am I saying that right?
yes, ma'am.
And so because they oversee the mock, they're overseeing the count and how it's conducted. And Kamisha has gone to them because I'm just being more blunt because you're doing a fabulous job of explaining what your conversation has been because she wanted to be, she's being transparent about what you all have asked of us to do, but she's also trying to work within the boundaries of what is currently established and be a good partner with the United Way. So she asked them the questions that she just explained and describe what the council is and this committee is wanting us to do to be participatory. Ideally, really drilling down on the incorporated areas of the city and the count. And that is also when she learned that the number, because I think this has come up before, that the number is not necessarily that they're trying to achieve some large number, because their interpretation of, and again, I haven't seen this written like formula-wise, that the larger the number means less funding potentially. But that's the conversation that she had.
Yes, that's the information that
And
I received.
I told Kamisha that's all well and fine, but for where we are, I believe that you all, and we establish, because we see it every day, are trying to identify with clarity that there are a lot of unsheltered individuals, and we are trying to capture those areas where between our officers and the outreach staff and the business owners and the residents, what we see in those pockets where we see them, that those individuals are being counted. And so as best as they will allow for that with this current point in time count that's upcoming, we'll still try to gather that with our volunteers, like you said, but it may not be that it is going to reflect those specific questions and things that are specific to the city.
Right.
Does that make sense?
Yeah, I have a follow-up question on that note. So you're not saying the higher the number, the lower the funding? That's not written anywhere in HUD.
It's not written, but that was the information that was provided to me when I was asking questions. I actually sent to United Way what I was gonna present on because I wanted it to be accurate. And I asked them, and that's when they shared with me, that.
Okay, so everybody across the country does a point in time count.
Right, and so what also was shared that everybody around the country does the point in time count, but there's not a standardized way. So HUD doesn't tell you how to do it, what questions to ask, but they just give you a foundation of this needs to happen this day and time. But every state executes differently.
Got it, thank you.
And the formula is encompassing of multiple different things, not just how many individuals are reflected from the count itself.
Correct.
And whatever interpretation our mock has been utilizing they are indicating that, I think they try to keep it not flat or level, and I don't want to speak for them, but they're saying it's not necessarily that, and showing an increase in the number of unsheltered individuals is going to also mean that the funding increases, because there's these other factors that are part of.
Right. So the application has different components in it, and the pig count is just one. So the application will also talk about the permanent supportive housing piece of it. And if you, and I don't have that, I apologize, but if you look at the allocation of the funding, once MOC gets it, permanent supportive housing actually gets the bulk of it. Any other questions? So next, we are looking at the 2024 point in time count, and it'll show you, the top graph shows you the different categories. So that's all people experiencing homelessness in 2024 was 4,593, and then it breaks down the categories.
That's
So-
for the entire state,
Yes, sir.
4,593.
Yes, sir. And then it shows you the percent change from 23 to 24. It's a 13.3% increase. From 2007 to 2024, it's an 18.9 increase. All people experiencing unsheltered homelessness in 2024 is 1,846, and so on. And you can go down the line and read that. The second graph is strictly overall chronically unsheltered individuals. And I would like to highlight that in 2020 and 21, the pig count was done differently due to COVID. So now, historically, the pig count, you go to a person, you ask questions, you engage them. During COVID, they just looked at people and decided that they were homeless and counted them.
Interesting.
So I just share that to say those 2 years for the numbers, right? So, because you see in 2021, it shows 396 people were homeless. That cannot be
I
accurate.
don't know where they were looking,
The problem is that they were just looking.
not too hard.
I mean, none of these numbers are particularly
I don't want to get accurate.
accurate.
So the next slide is just showing over the past 5 years, how many counties participated in the count, and how much money was awarded from HUD. And again, the asterisk is just to remind you that during the pig count, it was not conducted.
And the counties counted are within the mock.
Yes,
Okay.
yes.
So you can choose not to participate?
You cannot have volunteers in that part of the county to participate. And the
Okay.
way I understand it is that MOC reaches out to the providers in that county so that they can coordinate a team.
And they still get funding, even if they don't participate.
They get funding, the
MOC
right,
funding.
MOC
Well,
gets the
allocated
funding,
it.
and then MOC will allocate it to the different counties. So according to the numbers, you would think that if the unsheltered count was larger, you get more money, because you see how it increases. But
That 4.7 million, who is the trusted agency that goes to?
Mock
So the MOC,
Way,
who's the head of the MOC?
right away.
United Way.
The United Way
Yes, sir.
received that $4.7 million.
Yes.
What is the city's role in the MOC?
We are active members, and right now, Ms. Franklin is going through orientation to sit on the board.
So we haven't sat on the board in the past?
No.
No,
Okay.
that's another first. That's a good thing. That's, efforts in our continuous, particularly of the recent years when you all have been at the table on this in particular to say we need to be. So,
Is there, Kamisha, is there, for that $4.7 million, are there general categories that you know of that a large percentage of that funding goes towards?
Permanent supportive housing.
Mhm.
So that would be a Mercy, that would be a Columbia Housing, that would be USC supportive housing.
Homeless no more.
Homeless no more.
Okay.
Right.
So like
Yeah.
for mental and substance providers do not get any of that $4.7 million to operate?
Now, I wouldn't say they do not get it. They just don't get as much as permanent supportive housing receives. Permanent supportive housing is the evidence-based model that HUD says works. So it's the housing first, meeting the person where they are, so not addressing the mental health or the substance, addressing housing first. So placing them in a home and then start working on those underlying issues.
it could be, I guess, some of those direct allocations that you just named, maybe they then sub out, kind of like we do with some of our grant funds, maybe for mental health and substance abuse. Do they ever have some of their funds that they then redirect towards those things that you,
MOC or the provider.
the provider? Do they have sub-recipients or they don't?
No, this money that they get, and somebody correct me if I'm wrong, is already allocated to a plan. So it's not for them
Okay.
to, it's for them to serve those individuals.
Directly.
Yeah. So how do we get involved? Volunteering with the count. Community members can volunteer to participate in the count itself. So we talked about these things. So you can volunteer by doing the actual count in the field, or you can do some data entry. Training is required for all volunteers. They do have the training virtual. So if you wanted to participate, orientation is on January the 15th at the library at 2 p.m.
So that's in person,
That's in
Hello.
person.
but you'll have access to online, that
Yeah.
recorded online?
Yes, sir. Any questions about volunteering?
So we'll get together to drill down on that because is that suggesting that our city volunteers would all have to go in person or we will be able to,
You could have
Mr.
access
Brennan's
to the
point?
recording.
Okay,
Mhm.
all right.
And I just want to say this and put this out there. I really would like, because we have invested so much, I really would like the city to show up on this pig count. I really want us to be in the community in places that are not being counted and identify those individuals who are experiencing chronic homelessness. The next slide is just a sample of the questions that they ask during the pig count. And this is my favorite slide. So this is a slide of the city and the slide of the county. And just how the county so overlaps over the city. And this is my call out to all the other counties to say that we need their assistance, we need their help in this endeavor. Together, I feel like we can do some great work in this area. Questions?
Before we take questions and move on to introductions of your staff, Mr. Mayor, do you have any comments, questions? Since you're in attendance, invite you to the table if you do.
As a committee structure, I would just say that I think the pit count is important, and I look forward that, we're all gonna be in it, but 2025 is the year that we've got to address the homeless situation. We have seen an increase, we know the increase is there. This pit count's probably the most important pit count that there will ever be. And I hope that we can work towards the wraparound service, the centralizing, making sure, because what we know is going on is that the community's not being served the way it needs to be, and the effect is unfortunately affecting them as individuals that are unsheltered. It affects residents, it affects businesses, so it's a community issue. And I think this is an opportunity that we can turn the compassion that we have as a community into an effort that we can, look, we're not gonna solve homelessness, but other communities have made major reduction by everybody coming to the table, and I think this is our opportunity. And I think Kamisha does an incredible job of what she, but that rapid shelter that the city came together in 90 days and put together was the incubator for what we've been talking about. So we know that it has a positive effect and it works. So I think the more and more that we can come together, I think this pit count's gonna be important. I think your point about identifying the areas that haven't been counted. I remember the last year's pit count, and we got calls from all over, North Main and other areas where we had pockets of homelessness that didn't get counted. And so I do think this would be a great volunteer day for us. I plan to participate. I hope others will participate. I think our staffs, this is an opportunity for us really to get a real hold. And, to me, this isn't the future of funding, which I think is crazy. If you have more, you get less in some kind of formula. But what I think it will do is bring more people together, which will develop more resources that we can leverage to really make a difference. But we're in crisis mode. And the capital city, and you saw in that 13 county area, I mean, we're it. This is an opportunity for everybody to come to the table. So hopefully we'll head there. I mean, we've sparked conversations. Some of them people don't like, some of them people do. But the reality is we've got to do something, and addressing this situation is different than it was 10 years ago,
Absolutely.
15 years ago, even 5 years ago. But what we've seen across the country and the resources that people are putting into it, we've got to be it. We've got to be it.
Appreciate that. Any questions for Ms. Kamisha? Kamisha, how about an introduction to your staff?
I would like to introduce my staff, but before I do that, I want to say to the public that this is not an attack on the unsheltered. The city manager, council, and the mayor have a really hard job in balancing everyone's needs. So that's the unsheltered, the sheltered, business owners, those communities. So this is not an attack on the unsheltered. This is an attempt to try to find the best way to assist them and bringing everybody together to do that. Nothing that we do will be done without compassion. But again, as the mayor stated, something has to be done. So with that, I have the best teacher in the world. And so if I could,
Go to the mic so we can hear their names on the.
look at Jonathan. So I'm gonna introduce him first. Look how suave he looks. This is Jonathan Cooper. This is our program coordinator. And I would ask him to stand up because I'm gonna want you to mention those things I talked about, Adopt a Palette. But he has done such an amazing job. It's like, it's who he is. And it just comes together organically. He sees a need, he reaches out, and it happens. Jonathan is working Sunday to Sunday. That's the only complaint I have, and that's what I'm working on with him, to have those self-care boundaries, because I can't afford for him to get burnt out and have to leave. But he's doing a great job. He is pulling, he's over shift staff. So that's a hard job in itself with 1,000 moving parts. Then also making sure the needs on site for the residents are there. And so he's doing a great job. Just stand right here for a second. Then Miss Franklin, Miss Naisha Franklin, she has been with us from the
Stand up,
onset.
Asia.
Come on over so the news could see you. She doesn't like that. But she is our project manager, and she started with us from the onset. She was the supervisor over the case managers, but she has grown so much, and she is doing so much for the program. She's now doing like data and grants and still managing case managers, ensuring that residents get what they need. And I know I talk so much about, social workers, and social workers are the best. And I still say that, but my team is not made up of social workers. And they still have the ethics and the compassion, and they still execute with care and making sure that we're doing what's needed during the time at the shelter and while they are permanently housed. Our newest employee is Erin Pace. Yay! Woo! Erin started out as our intern. She is now the community liaison, and she's doing an awesome job. We are able to expand due to the SCORF dollars, and I appreciate them for that. We were able to hire Erin on, and Erin is doing a great job pulling those innovative partners in to execute services as we discussed earlier. My intern over there is Kelsey Canty. Yay! But this is my team outside of.
Kelsey. Where are you in school, Kelsey?
I am a student at Limestone University.
Okay.
I'm getting
Where I
a
graduated
master's in
from.
social.
Yes, right.
Yes.
Thank you, everybody.
But I wanted Jonathan, because I didn't say the name right, for the church.
Palmetto Church of Christ is one of our really awesome partners. And like Kamisha mentioned, when it's time to get folks moved in, they spare nothing. That entire church community goes out, finds the donations, and not only do they find the donations, but they assist in moving those individuals into their home, really giving them that true fresh start. And then, of course, all of our residents are always invited back to the shelter for our initiatives and our fun things. And I'm excited about Adopt a Pilot. It's one of the things that really took off, like Kamisha said. I think we started it late, and we really nearly raised $10,000 with just support from the community, business owners, people that truly want to make a difference. It really takes a village.
Well, y'all are the heartbeat for the village.
And I just want to put this last thing out there. So Mr. Woodley is looking for somebody to donate a space, and he will fill it with furniture so that when residents are housed, they can walk through like a store and just pick what they want.
All right. Well, Kamisha, thank you so much. We are going to rely on your experience, your knowledge, past, present, and future, as we work towards our homelessness operations goals. So, Ms. Wilson,
Yes,
if there's
sir.
nothing else, we'll do the motion to go into executive session. Dr. Bustles?
I make a motion for us to go into executive session for discussion and negotiations incident to propose contractual arrangements pursuant to SC Code 30-4-70A2, homeless services.
There's a motion. Is there a second?
Second.
There's a second. Can you call the roll, please?
Mr. Bailey? Dr. Bustles?
Aye.
Mr. Brennan?
Thanks, everybody.